Imagine waking up one day in debilitating pain. You start visiting doctor after doctor, specialist after specialist, and the only option you're being given is to synthetically alter your hormones with no guarantee of relief. Your symptoms start intensifying, you develop digestive symptoms after some time, stools become harder to pass, it hurts to urinate. Intimacy is rare because it hurts so bad. You wait another 8 years from the onset of symptoms to finally put a name to your debilitating symptoms. This is endometriosis. Hey YouTube, Cindy here. I'm an endometriosis specialized dietitian and I've been working in the endometriosis and fertility space for over 5 years. And I'm expanding into YouTube to provide longer form content to continue to help you improve your quality of life and fertility with endometriosis. If this appeals to you, please be sure to subscribe and follow along for more. I just want to give you a little background about myself to help you understand my connection to endometriosis and why I even got into working in this space. I have endometriosis myself. I was diagnosed via laparoscopy in 2018 after 15 years of debilitating pain. Even prior to my surgery, I already had started applying a diet and lifestyle strategies to improve my endometriosis symptoms, and it was wildly effective for me. So now I provide free education as well as paid services to support others with endometriosis, find relief, and boost fertility. So what is endometriosis? Endometriosis is a chronic inflammatory condition of immune dysfunction, tissue that is similar but not identical to the endometrium, which is the uterine lining, grows on pelvic organs, the bowels, and elsewhere in the body. The most common sites of endometriosis lesions include the cul-de-sac, which is the cavity filling the space between the rectum and the back of the uterus, the left broad ligament, left uterosacral ligament, bladder, left ovary, sigmoid colon, right ovary, and left fallopian tube. You'll see a lot of books, research articles, and even randomized controlled trials using endometrial tissue and endometriosis interchangeably, but even the most revered organizations have it wrong if they do this. Endometriosis lesions differ from endometrial tissue in a few major ways. The first of these major ways is that endometriosis lesions have different estrogen receptors. The second is endometriosis lesions express aromatase, which is an enzyme that converts testosterone to estrogen. This is one of the major reasons why endometriosis is self-sustaining, as it's an estrogen-dependent condition. The third reason is the immune cell stimulus in endometriosis lesions express genes that support the survival of the cells. This is another one of those ways that endo sustains itself. The fourth reason is there is higher VEGF signaling in endometriosis lesions. VEGF is a signaling protein which promotes growth of new blood vessels to lesions. And the fifth major reason as to why they differ is that endometriosis lesions have more integrin expression. Integrin is a protein involved in adhesion of cells to neighboring cells in the adhesion process. So what are the major symptoms of endometriosis? So in addition to the symptoms I mentioned previously in this video, including debilitating pelvic pain, pain with passing stools, pain with urination, pain with intercourse, some other symptoms of endometriosis include bloating, nausea, extreme fatigue, pain with ovulation, heavy bleeding, large clots. Infertility is extremely common, low mood, depression, anxiety, back pain, leg pain, seemingly recurring UTIs. So what I mean by this is that your symptoms may present as UTIs, but you're not actually presenting with the bacteria if you're being tested. Bladder pain, urgency, and in severe cases, organ dysfunction, difficulty breathing, and even lung collapse. So how is endometriosis treated? I like to use the word manage because there really isn't an effective treatment per se for endometriosis. I think that treatment would imply that the condition gets better. So current treatment options fall under four main categories: hormone therapy, surgery, anti-inflammatory medications, and diet and lifestyle strategies. Contrary to popular belief, hormonal birth control and other forms of hormone therapy cannot be safely prescribed to all endometriosis patients. This is a topic I will discuss in more detail in future videos. Hormone therapies include a number of different types of medications, including combo birth control pills, progestin-only pills, and gonadotropin-releasing hormone agonists and antagonists. Both of these medications, and here I'm referring to gonadotropin-releasing hormone agonists and antagonists, work by suppressing luteinizing hormone and follicle stimulating hormone, which block ovulation and suppress estrogen and androgens to very low levels, similarly to what you would see in menopause. The combo birth control, which includes estrogen and progestins, block ovulation by suppressing FSH and LH release from the pituitary in the brain. If taken continuously, combo birth control pills reduce the uptick in inflammatory chemicals called prostaglandins that cause the uterine contractions responsible for the shedding of the uterine lining. Prostaglandins also cause the pain associated with menstruation. On hormonal birth control, you'll produce less estrogen and no progesterone since it will be blocking ovulation, and we only produce progesterone if we ovulate. Endo is in part an estrogen-dependent condition. The blocking of estrogen and lowering of inflammatory prostaglandins are where the benefits come from when it comes to using hormonal birth control for endometriosis symptom management. The progestin-only pill, or the mini pill, works similarly to the combo birth control. It just doesn't contain synthetic estrogen. Norethindrone or Dynagest are examples of progestin-only medications. Not all birth control pills are made the same. Some contain interesting ingredients you should be aware of, especially if you are iron sensitive, lactose intolerant, or sucralose sensitive. Check out this list of some common birth control pills and the sneaky ingredients you may find inside them. This is especially important to consider if you started experiencing changes in your digestive symptoms when you started a new combo or progestin-only pill. The IUD is another form of hormone therapy used to manage endometriosis symptoms. Progestins come in different forms. Progestins you often find in IUDs, and the medroxyprogesterone and dydrosterone are more structurally similar to natural progesterone that's produced in the body after ovulation, whereas levonorgestrel, norethindrone, and drospirenone are more structurally similar to testosterone. This means that androgen excess symptoms can intensify in androgen-sensitive individuals when using this form of progestin. So keep this in mind and maybe consider actually having your androgens tested prior to starting on one of these IUDs, combo pills, or progestin-only pills. Research shows that a Mirena IUD combined with gonadotropin-releasing hormone agonists was effective at reducing pain with intercourse and resulted in lower levels of estradiol and FSH, LH, and CA125 versus those who were treated with a gonadotropin-releasing hormone agonist only. Because these medications block ovulation, you would expect your estradiol, FSH, and LH levels to come down. Conversely, other small studies have hypothesized a connection between IUD use and the development of endometriosis. In a review of 4 randomized controlled trials, no studies reported outcomes of overall pain improvements. The results were unclear regarding whether the IUD improved pain with menstruation after 12 months. It was also unclear whether the IUD improved quality of life after 12 months. One of the studies showed improvements in quality of life after surgery with the insertion of an IUD. Post-operative melasma and bloating was reported in one study following the insertion of an IUD post-surgically. Other studies propose a connection between mast cell reduction via the Mirena IUD placement, suggesting a connection between pain, mast cells, and endometriosis. There is an established connection between estrogen, especially when it's high, triggering mast cells to release histamine, and histamine can act on smooth muscles, contributing to cramping and pain. In general, when asked about hormone therapies, and I'm asked so often, the Mirena IUD and the progestin-only pill have fewer side effects. In the case of the Mirena, roughly 80% of women will start cycling after 1 year following placement, which I appreciate as it allows for the production of anti-inflammatory, anti-proliferative, mood-boosting, and anxiety-reducing progesterone. Because remember, you only produce progesterone after you've ovulated. Progestin-only medications can contribute to elevated blood sugars, but the effects on cholesterol are positive. So progestin-only medications tend to increase HDL, which is the good type of cholesterol that moves from various parts of the body to the liver for excretion, and lowers LDL, which is the type of cholesterol that has the opposite effect. Progestin-only medications also don't appear to have the same negative effect on thyroid function as other forms of hormone therapy. All those benefits considered, progestin-only meds and the IUD still do affect digestive health markers and have been observed to elevate liver enzymes. So these are things to keep in mind. Surgery is also a management option. In fact, it is the gold standard management option, but it can be hard to find a specialized surgeon, and it is absolutely important that you find somebody who is specialized in endometriosis excision surgery over ablation. Excision surgery is the removal of endometriosis lesions from the root using a sharp tool, scalpel, or laser. Ablation, on the other hand, is a superficial burning of endometriosis lesions that does not remove the lesions from the root. Studies show improvements in pain are better with excision surgery compared with ablation. Chronic pelvic pain was also reported to improve with excision compared to ablation, and recurrence rates of endometriosis were significantly higher with ablation than with excision. So one of the most recent statistics is about 59% recurrence rate with ablation within a short period post-surgery compared to 23.5% with excision. When using diet and lifestyle strategies to improve endometriosis symptoms and quality of life with endo, the focus is largely on making improvements to the major hallmarks of the disease. So this includes improving gut health, balancing hormones, promoting better blood flow, and reducing overall inflammation. A few examples of how diet and lifestyle interventions can make a difference include, firstly, by improving elimination of waste or excess hormones through the liver and stools, things like adequate fiber intake, consuming cruciferous vegetables, getting enough omega-3s, and diversifying the plant diversity in your diet, so specifically the colors coming from plant foods in your diet, can help improve elimination. Another way that dietary and lifestyle tweaks can make a difference to endometriosis symptoms is by reducing the overall inflammatory load on the body. Fruit and vegetable juices have been shown to drastically increase the inflammation-fighting antioxidants in the bloodstream. High moisture, low heat cooking methods reduce the production of inflammatory reactive oxygen species. So when I say high moisture, low heat, I'm referring to things like poaching and using slow cooker or pressure cooker methods. And in general, the plant diversity in your diet equates to the diversity in your large intestine microbiome. I encourage you to stick around for other videos on the connection between the gut and endometriosis. The research we have available is fascinating, and I've seen this connection come to life when I've worked with clients on improving their digestive health and just how drastically their endometriosis symptoms improve. Certain foods help promote healthy hormone levels. Foods like white button mushrooms, flax seeds, parsley, celery, chamomile, and sesame seeds can block the conversion of testosterone into estrogen to lower estrogen excess symptoms. Remember that endometriosis is an estrogen-dependent condition, so many of us have excess estrogen symptoms. Conversely, if you want to promote conversion of testosterone to estrogen to reduce estrogen deficiency symptoms, foods like asparagus, onions, licorice root, and red leaf lettuce can help. And these are just a few examples. Blood sugar dysregulation is a massive contributor to endometriosis pain symptoms and other similar symptoms. And so spacing your meals 3.5 hours to 4 hours apart and structuring them to include a protein, fat, and fiber is an amazing first step that you can take to support healthy blood sugars. You may also see a positive spillover effect into your energy levels and sleep quality, since poor blood sugar balance is one of the leading causes of poor sleep quality or issues falling or staying asleep. Now, I'm all for a health at every size approach if this is something that feels right and good for you, but it is just a biological truth that carrying excess adipose tissue is a source of estrogen. So another way that you can help improve your endometriosis symptoms, if applicable, is through dietary and lifestyle modifications to help aid weight loss. More and more research is coming out too about the autoimmunity and gut connection. There are also several dietary triggers for autoimmunity. We can also help improve endometriosis symptoms and reduce autoimmune disease risk by providing education and guidance on dietary patterns that may help reduce that autoimmune disease risk. Examples are targeting the diet specifically for autoimmunity against the thyroid or celiac disease. You have a lot of control over your digestive symptoms by using tailored or targeted treatments treatment diets to help reduce bloating and normalize digestion. I want to highlight a couple of the findings from this review on how diet can make a difference to endometriosis symptoms. So one finding was that vitamin A, C, and E, which are known antioxidant vitamins, helped to improve the inflammation fighting capacity of the antioxidants in the bloodstream. The review also identified a link between autoimmune disease risk and vitamin D deficiency. And so by maintaining healthy vitamin D levels through adequate dietary intake or supplementation, we can also help mitigate that risk. They found that excessive intake of red meat and or butter increased estradiol and estrone synthesis. And remember, endo is an estrogen dependent condition. It's not necessarily problematic if you have high levels. It's more problematic if you're not actually able to eliminate your estrogen. They also found that trans fats increased inflammatory markers in the blood quite significantly. So this is one aspect of diet we really want to be avoiding. The review found that magnesium helps to relax smooth muscles, leading to fewer cramps, less pain, and better elimination through the bowels. They also found that soy, so contrary to what you may have seen or read, actually has anti-estrogenic properties, which can help keep estrogen levels nicely balanced in the body. Now here I'm referring to whole food sources of soy like organic tofu, tempeh, or edamame. Green vegetables and fruits and the nutrients contained within them were shown to have strong effects on methylation and improved hormone elimination. And if you're not familiar with what methylation is, it is a method by which we methylate various things, estrogen included. We also methylate serotonin into melatonin. We methylate arsenic. So it's an important detoxification system that we want to be supporting with endometriosis. And separate studies have shown improvements in pain, improvements in energy levels, and allowed the participants to develop better and deeper understanding of how diet and lifestyle can truly make a difference to their overall health. So in this video, we've talked about what is endometriosis, symptoms of endometriosis, the most common management options that are available or treatment strategies. And I want to wrap up by providing a couple of tips. My first tip is to keep a journal of symptoms. You can print off a visual body pain image and present this to your healthcare provider. It's helpful often to have a visual of where you're experiencing pain and how often. It's also helpful to print off a document that lists different descriptors for your pain and circle the ones that apply to you. My second tip is don't consider endometriosis as a condition in isolation. Everything that happens in your body affects endometriosis, and this includes changes in your bowels, the foods you eat, stress, sleep, and more. My next tip, if you have any symptoms of digestive dysfunction, start here. The gut is the epicenter of health, and we are learning more and more about how every other system in the body is connected to the gut. Stay tuned for more videos on this topic. And my fourth step is take action now. If you're experiencing a lot of really intense pain, my suggestion is to create yourself a pre-period protocol to help reduce some of that inflammation in the high pain phases of your cycle, which will hopefully help improve your quality of life so you can be a little bit more proactive in other areas of your life. I'm definitely going to create some videos on making your own pre-period protocol. In the meantime, you can consider the Endo Flare Care Relief Blend. The Endo Flare Care Relief Blend is a formula that I formulated, which includes all science-backed ingredients that have been shown to reduce pain, inflammation, and body discomfort in endometriosis patients specifically. Other things you may consider in the meantime, before I get that video up for you, is just look for ways to maximize the nutrient density in your diet. Think about what gaps you may have in your diet. Like, are you excluding dairy? Are you supplementing magnesium? Are you eating oily fish? Consider these nutrient gaps and consider how you might be able to bring in some other calcium-rich foods if you're not consuming dairy, or maybe you can add in an omega-3 supplement if you're not consuming oily fish. And my last tip is, if you haven't explored diet and or functional medicine as a way to manage your endometriosis symptoms or improve your fertility, consider booking in to discuss support with me. I'll put the link below, and I look forward to connecting with you. Until next time.